Oh, I love our chefs in the kitchen, only for the fact that they're women, but they do so much. And we all know that women play such integral roles in our lives. They're mothers, they're wives, sisters, friends, very important members of the community. And they need to also make sure that they take care of their health in order to continue playing those important roles.
And it's so important. Today is Wellness Wednesday, and Ewan's about to find out with one of our experts to, exactly what is easy, affordable, and of course, what is fast in order to help our female viewers make sure that they look after their health and their well-being first and foremost.
So on your Wellness Wednesday with Medicare, right here on your Feel Good Breakfast Show, this morning we're focusing on women's health and wellness, because we know, in my eyes, women are superheroes. They often are. They're moms, they're wives, they hold down full-time jobs, and most oftentimes as well responsible for the family and household in terms of the running thereof. So it's a lot to take on board. So this morning we're dedicating this segment specifically for you, and we're hanging out with a Medicare expert pharmacist, Lebohang, to talk about women's health. Lebohang, thank you very much for joining us this morning once again, and I'm glad we're talking about this topic, our superhero women. Now, taking a look at health and wellness, specifically with regards to women, is there kind of a holistic view?
You know what, you started very right there when you said women are dynamic, they're all that and that. With us at Medicare, we believe that every woman is unique, and every condition that they bring is a unique condition. So as unique as they are, we at Medicare believe to treat every condition as it comes uniquely and individually as it deserves. And with the subject, usually it's a very sensitive subject matter, and it's very private. So we have to remember that with women experience so many stages before they can be grown-up women. In their lifetime, women experience like your menstruation, the first encounter. Then from menstruation, you have to deal with contraception. From contraception, you have to deal with pregnancy. All those issues have their own dramas and everything that you have to handle. Then from pregnancy is pre-care and antenatal care and prenatal care. You have to handle all of those. And then that's mother of all, menopause. So there's a whole lot of that, but we have to understand that we have to treat it individually and uniquely as it's presented. And
at Medicare, you have those professionals on hand.
Oh yes, starting from the healthcare professionals, from the floor to the pharmacist, to the nurse, to the doctor on site, everybody can handle the issues. Yeah. Especially when a member comes to you, people, especially women, will be very sensitive. They won't want to discuss it openly. So we'll offer that security. When you speak of women's health, you have to empathize with the women. You have to make them understand that it's a common condition, whatever they're telling you. It happens to everyone at some given point in time. So that once they feel comfortable with you, they can then answer any question. So you have to make them at ease so that when you ask questions, they come up front with what you need to find out from them. But sometimes you get those conditions like urinary tract infections, your sexually transmitted diseases, then those ones now, we cannot handle at the dispensary level. That's when we now refer you to our nurse, the privacy of the clinic. The nurse will take it further with contraception, because again, with contraception, it's not one size fits all. It's another unique case.
And once again, contraception is, I think, one of the most common issues that women have to deal with. And even though it is common, it's still a sensitive issue.
Definitely. And again, like I said, it's not a one-size-fits-all. Every woman is unique. Before you even suggest any contraceptive, we at Medicare, we have all healthcare professionals who are well-trained to assess the situation. We start by checking your lifestyle, your age. You have to consider things like this. You don't just put somebody on any contraceptive. But more than that, we have the nurses, professional, hand-picked, qualified nurses on site that deals with it. And they also get the help from the doctors also, like we have the video med. They can refer the matter to the doctor, who can even give, if there's any STIs there, they can give the treatment.
What I love in terms of hearing what you are saying with all of these issues, with everything that women have to deal with, specifically those sensitive matters and matters that's very difficult to talk about, Medicare really seems to facilitate this supportive role.
Exactly. You know what, with us, there's also, like, going back to the contraceptives, we have this campaign whereby you see the doctor, our video med doctor, like you come to the pharmacy, you come to the pharmacist, because the law doesn't require me to give you a contraceptive there and there. I can take you to the clinic, then the doctor will actually see you and give you a prescription on site. It can be a 6 months prescription. Then you bring it back to the dispensary where I'll be loading it for you. And every month we can call you and remind you that you still have that 6 months repeat script that we can even deliver for you. So by doing that, you're never alone. It's a supportive system, and we make sure that you still comply with what we started at Medicare to start with.
And what I love about that fact is because women are so busy, they don't necessarily have the time to run around or make appointments or go see a doctor. It's taken care of right there and then.
There and there, as you get to the pharmacy. And Ewan, another common condition that most women experience is your UTIs, which is your urinary tract infection. So the lady will just come to you and tell you about the frequency of urination. They'll tell you the urgency. When they get to the loo, it's just drop there. And sometimes they can even tell you they can see some blood. And then it starts worrying when they tell you about the color. Because usually when they come to the pharmacy and tell us about that, there's questions that we also ask. When did it start? How often is it? Are you drinking water? Do you exercise? Maybe it's dehydration. So with urinary tract infection, you'll get that urgency. The lady will be telling you, I'm in and out of the loo the whole night and all that. Or I'm seeing it's dark color, or it's like burning sensation before. So all of that we take into consideration, and then afterwards we can treat you with self-medication, which is we can give some medication, some alkalinizers, and sometimes you can even add some anti-inflammatories because you experience some pain when you have that urgency. But failing so, if there's any color change again, that's when we'll refer you again to the sister who will do some urine dipstick in the clinic. And if she finds anything abnormal in your urine, she'll refer you to the video med doctor still in the clinic. Then the doctor will just pop up as an online doctor that you can see and speak to the doctor and even give some history to the doctor. Then they can get the proper diagnosis for you. We immediately get a prescription for you, for the patient. Then she can bring it to the dispensary. Then we dispense it. We as pharmacists will take it from there, counsel the member how to go about with the medication, and also how to lead a normal life and avoid conditions like that again.
And I love the fact that confidentiality is key.
And we have to treat it like as professionally as private, and also considering the norms and values of the member, because some members are not upfront with that. So you have to actually dig deep. That's why you have to create that environment where they can trust you.
Ask those questions. Bong, thank you very, very much for talking about the subject this morning. Really appreciate it. Like we said, women are superheroes. So women's health and wellness, that is what we're focusing on your Wellness Wednesdays with Medicare.
Medicare, reinventing pharmacy for you.